Hi everybody, and welcome to my first ever pregnancy update vlog. I don't really know what to call it, but you get the idea of what we're doing today. So I really wish that I'd started this in the beginning, but I've had a lot go on between that time, but you know, better late than never. Today, to this very day, I am 29 weeks pregnant, which is crazy because in a week's time I will be 30 weeks pregnant, and it's so quick. I can't believe that all this is going on. I don't know. Hello Kicken, and Kicken's here as well. I suppose it's a lot for my brain to process right now, considering everything that's been going on. And I will discuss what has been going on and why I have been so absent from TikTok and YouTube and Instagram, but I'm now obviously back on all forms of my socials. But yeah, but first thing I will cover, I've got a little list. I'm gonna go off a list, aren't we, Kicken? She's guarding the list for me. Oh, you're right there. And at the end I will do like a bump reveal so I can show you how big I am this week. I just feel like I'm getting bigger and bigger every week. I feel humongous, but you know, we're supposed to when we're pregnant, I suppose. So this week I had my midwife appointment. I don't know what everyone else sort of has, but for me I'm high risk, so I have a midwife appointment from now on. So now I'm 29 weeks, I'll have a midwife appointment every 2 weeks, and then I've got a scan every 3 weeks, and I think that will increase near the end. But I know towards the end my midwife appointments will get sort of like every week, which is okay, but I know it's for the best. It's best for the baby to be that way. So midwife appointment this week. We discussed a few things, a lot of my anxieties as well. So I've never been in natural labour. Lo and behold, I've had 5 babies and I've been induced every single time. So I said to her, I said, like, what do I do when I go into labour, because I don't know. And it's like, well, I should know because I've had 5 babies, I should know what labour feels like. But when you're started artificially, and that's basically what an induction is, it's really intense. There's no like slow build up, it's like bam, contractions, and then they give you the drip, and that's what happened to me anyway. So because I have been I think called it GBS positive in the past, when I go and give and go into labour, I need to have antibiotics like as soon as possible. I've been okay in the past because I've been induced. They've just given me as soon as I've been on labour ward. So basically, as soon as I know I'm in labour, I've got to go. I just got to go to hospital. And she says, you'll know when you're in labour. I'm like, yeah, I felt contractions before, but when I felt them, they've been really intense. So I need to kind of maybe look up or learn or read. I know, like they say, backache, tightenings, cramping, that kind of thing, that are regular. So if they stop, then it's not proper labour. But if they get regular and more intense and closer together and all that kind of stuff, then I need to like be heading to the hospital. I will be delivering on consultant-led unit as well. So yeah, so because I'm high risk, I'm on consultant too. But yeah, so I think I'll be okay. And then I asked the big question, like, what happens if I go over? So it'll be like the same thing all over again, like when I had Amelia, because I went 2 weeks over with Amelia. So they give you a sweep at 41 weeks, and then that doesn't work, you're in for an induction at 40 plus 10, as in 10 days. So that's fine. I said to her though, I did ask, like, statistically, if I was to go, like, you know, do you think I'll have this baby around the due date because I've had so many? She says it's more likely that I will just go into natural labour the closer I get to 40 weeks because I've had so many. They see this all the time with women that come in and have multiple pregnancies. So I'm not too worried about that. I know what I've got to do, I know where I've got to go, I know what I've got to pack. And yeah, and I'm not going to say no to an epidural. If I need an epidural, I will take that. I like them, they're great. I've had 5, they've worked wonders for me. They help me relax as well, because obviously if you're in pain you're not going to relax. I'm going to try hypnobirthing though. I'm going to try some breathing methods and breathing techniques. I'm going to give that a go. Also at the midwife appointment, she did my blood, so took 3 lots of blood. One was on my iron, one, I can't remember what the rest was. Oh, and one, they did this new thing now, instead of going for a screening for gestational diabetes, which they give to most women, they just do this one blood test which does what it needs to do, so you don't need to go in and drink that flat Lucozade tasting drink. You can just do everything in clinic, which is great. I suppose it just stops us from going into hospital a lot, so that's fine. What else did we do? Oh, we listened to baby, listened to his heartbeat. He was still breech. I kept feeling like a lump up here, and I thought it was his head, and it was his head, and his head right up there. But today and yesterday I've not felt that sort of like head up here, so maybe he's turned, maybe I'm lucky. he's flipped, but they're not worried, considering that I've had so many babies. He's got space to stretch and move around and do cartwheels and flips, so he's good. They only really get worried if you come to like 36 weeks, I think it is, and if your baby hasn't turned by then, they then put in things in place like manually turning your baby. And I'm not sure what happens sort of after that, but I don't want to fill my mind with like the what ifs. Oh my gosh, you know, this could happen, because I've already got really bad anxiety, so I know my triggers and I know not to do or ask questions that will trigger if it's not necessary. If it's information I need to know, I ask. If it's not, I leave it. That's how it goes. Also, like, I've got, I don't know if I said before on my socials, but I've got SPD and I've got sciatica. I've had sciatica since I had Amelia. It's mainly in my left hip. It's getting worse, but the SPD especially has got worse. I'm not sure why. Well, I probably do know why. It's because you've got a baby and it's pressing down on your pelvis, and that's what happens. And I know it gets worse in every pregnancy, so that's grand. You're right there, she's just chilling. Look how chill she is. Are you chill? Yeah. Yeah. But in terms of sort of what I was going to cover in the beginning of the video, my mental health. So I am I am diagnosed with something called health anxiety, which was a trigger from when I had Charlotte. So Charlotte was very ill after she was born. About 2 weeks after she was born, she had bronchitis and a collapsed lung. We were very close to losing her, which was very, very scary. And since that point I've been very paranoid of my own health, with Dave, with the kids and things like that. So it's like a collective sort of all-round health anxiety. But since being pregnant it's got worse because of hormones and things like that. And that's why I had like such a big break from social media, because I wasn't in the right mental state and I just couldn't do things for myself. And to say it was the worst time that I've ever experienced, it really was the worst thing I've ever been through. I tried to go on medication for it. It didn't work, unfortunately. Sometimes it does for some people, sometimes it doesn't. We all react to things very differently. So yeah, it was a really horrible time for me. My turning point though was around Christmas Day was my turning point. And I sort of took myself off the sofa and I said, no, I'm not doing this anymore. I'm not going to miss Christmas because of this. And I know that that won't be the same for a lot of people. But I was stubborn with myself and I said, no, we're going to get off the sofa and we're going to go make Christmas dinner. And I did. And from that point on, I've been getting better and better and better every single day. I've been speaking to a therapist. They've been really helpful. And now I'm on sort of a plan to do like talking therapy, because it isn't just what happened with Charlotte. It's actually something that's been there since I was about 14, when I lost my sister and my dad. And it kind of runs in the family as well, this health anxiety. My brother has it, or had it, but he's far better than he is now. And my dad had it as well. So that mental health can run in families too. My dad had quite a lot of depression and things like that, so, but also having a traumatic childhood can also cause those things. I kind of felt bad because I never addressed it before. Like I kept saying to myself, why didn't I just get counselling when all this stuff happened? But I was 14 and when I was 14, that was like how many years ago? Over 15 years ago. And mental health wasn't really spoken about that much all them years ago. But I'm glad that I'm at the place that I am now. I'm thankful that I've got the support that I have. Dave has been amazing. The kids just brighten my day every day. And they keep me going, and they keep me sane, and they keep me wanting to be here, I suppose, and do all of this. If anyone else is struggling with their mental health, I would really, really urge you, please get help for it, because you don't have to suffer and think that no one else is the same as you. Now, when I put out, I think it was on Instagram that I first put out that I had health anxiety, a lot of people reached out to me and said, I thought I was the only one. I thought this was only happening to me. And it really isn't. There are so many people out there that are going through the same thing. Like, it is a thing. And as horrible as it is what you're going through, to know that there are other people out there that are going through the same thing as you and you're not the only one, it is comforting. And I've had a lot of people say that to me, that it's nice to know that they're not alone, and you are literally not alone. In any form of mental health, you're not alone. And I'm really happy that I got the help that I did. I really hope that you've enjoyed this video. Let me know if there's anything that I've missed, anything you want to see. I am going to make a video about all the things I've got for baby as well. It's a mess right now, but we'll get, we'll clean it all up. We'll sort it all out. Car seat, there's his car seat right there. And there's his cot thing that sticks to the bed. But I will do a video on that very soon. But now I'm going to do like the bump reveal, because it is humongous. Here, I know, like, my bedroom looks an absolute mess. Here is the bump reveal. So, I mean, I'm wearing leggings. But this is my bump at 39. Whoa, we're not there yet, love. At 29 weeks pregnant. Yeah, all of his feet are like this side of me. He likes to be this side. I do also have is it anterior placenta? My placenta's at the front, and that's cool. But I can still feel him move just like I did with all the others, and I don't know if that's because like this is my 6th baby, so like my womb is like super stretchy. But yeah, he's cooking well. It's the boy number 2, the boy. But yeah, there we go.